A British pilot who recovered from COVID-19 may be returned home. The pilot works for Vietnam Airlines. A sample of the virus taken from the patient and cultivated in the HCM City Pasteur Institute showed that he has developed immunity and he will not get reinfected by the virus, but he would still need a lung transplantation. Now, Charlene Navaja joins us live from Hanoi, Vietnam. Hello, Charlene.
Hi, Alma, and to all who's watching.
Good afternoon from Manila.
So here's the latest here in Vietnam. Okay, in Ho Chi Minh City, the health ministry plans to return its most critically ill COVID-19 patient, a British pilot working for Vietnam Airlines, to his home country as he has recovered from the disease, with a lung capacity reaching 30%. So Luang Ngo Kwe, the head of the ministry's Department of Medical Examination and Treatment, confirmed that the patient had tested negative for the new coronavirus 6 times over the past 10 days. The ministry is set to transport him to the United Kingdom when he becomes well enough to travel. He added that the Ho Chi Minh City Hospital for tropical diseases where the patient is being treated had fulfilled the mission of treating the British pilot patient. His lung capacity has risen to 30% from the 10% recorded a week ago. The 43-year-old man will be transferred to Chorai Hospital in Ho Chi Minh City for further treatment. The British citizen, tagged as the 91st case, has spent 63 days at the hospital with 46 days on an extracorporeal membrane oxygenation, which is a life support machine. Regarding the lung transplant plan, Kwe noted that up to 59 people aged between 21 and 76 had volunteered as partial lung donors to save the British man. However, he needs a double lung transplant with an organ donated by a brain-dead person. The pilot weighs 100 kilograms and is reportedly experiencing cytokine storms, an overreaction of the immune system causing it to attack even healthy cells and organs. So, Alma, just a quick updates for the numbers. Vietnam has a total of 324 COVID-19 cases, but 266 already recovered, and 18 are experiencing the relapse, but there are no reported deaths. And in another news, 5 million made in Vietnam medical protective equipment transported to New York. So a Vietnamese company has shipped 5 million medical protective supplies to authorities in New York, U.S. Huỳnh Quoc Dinh, a director of Supercargo Service, said that the protective suits, face masks, and gloves have been transported to New York to support the hard-hit city in the fight against COVID-19. So he said the company has cooperated with 4 airlines, namely Ethiopia Airlines, Cathay Pacific, Ava Airlines, and Philippine Airlines, to transport the equipment on 8 big-size planes. The New York authorities reportedly received the last batch on May 20th afternoon, local time. And in early May, CBS News reported that New York Mayor Bill de Blasio had discussed buying medical protective equipment from Vietnam. He said that the city had ordered a factory in Vietnam to manufacture the equipment in large quantities to help the city of U.S. And New York is one of the biggest coronavirus hotspots in the U.S., with more than 364,000 positive cases and more than 28,700 deaths as of the morning of May 21st. Back to you, Alma.
Okay, so since countries are already opening up, do you know what Vietnam has done to restart the economy?
Well, Alma, like other countries hit by COVID-19, Vietnam's economy has also suffered significantly over the course of the outbreak. So its GDP fell to 3.8% in the first quarter of 2020 as compared to 6.8% last year, according to the General Statistics Office of Vietnam. So in the first 3 months of the year, Almost 35,000 businesses went bankrupt. The first time in decades, the number of companies shutting down was higher than the newly registered businesses. So, to help recover the economy, so the Vietnam government has launched a $10.8 billion credit support package, and they lowered the interest rates, and they delayed the payment of taxes and land use free for fees for several business lines. And it has further issued financial assistance for both employers and employees affected by the pandemic. Alma?
All right. Thank you very much, Charlene. Stay safe, stay healthy. Thank you for your time.
You too, Alma, and to everyone. So this has been Charlene reporting live from Hanoi, Vietnam. We live in interesting times.